Welcome back to Edutube. Science is simple. Everyone knows that smoking is harmful, but it's important to understand exactly why. A cigarette is made of dried tobacco leaves mixed with chemicals to burn slowly. When burned, it produces smoke that contains thousands of harmful chemicals, including tar, nicotine, and carbon monoxide. Breathing in that smoke can make the chest feel tight or cause coughing, not just because of the smell, but because dangerous chemicals are entering the body. From the start, tar, a sticky black substance, starts to coat the teeth and gums. This damages the enamel, which protects the teeth, and can lead to tooth decay. As smoke travels through the throat, trachea, bronchi, and bronchioles, it interacts everything along the airway and finally reaches the lungs. The inner lining of airways are ciliated cells. They have tiny hair-like structures called cilia, covered by a layer of mucus produced from goblet cells. The cilia move in a wave-like pattern to push out dust and germs trapped in the mucus. However, when tar from smoke mixes with the mucus, it becomes thick and sticky. This makes the cilia stop working properly, and in some cases, the ciliated cells even die. Goblet cells try to help this situation by making more mucus, but this just clogs the airways even more. The airway gets narrower, breathing becomes harder, and coughing happens as the body tries to clear out the extra mucus and harmful substances. Since the dust and bacteria are not removed properly, infections are more likely. It can lead to bronchitis, where the airways become inflamed and swollen. Smoke particles can also reach deep into the lungs, into tiny air sacs called alveoli. The linings of alveoli have very thin cells, where oxygen enters the blood and carbon dioxide comes out. Alveoli are very delicate. The chemicals in smoke weaken and damage alveolar walls. This can lead to a disease called emphysema, where the alveoli are destroyed permanently, and some alveoli may even burst. This reduces the surface area for gas exchange, making it harder for the lungs to take in oxygen and remove carbon dioxide. In long term, more and more alveoli are destroyed and the airways become narrower. This makes breathing harder, and the person gradually feels more shortness of breath. This condition is called chronic obstructive pulmonary disease. Cigarette smoke contains another chemical called nicotine, which can pass through the thin walls of the alveoli and quickly enter the bloodstream. It then travels to the brain. Once in the brain, nicotine triggers the release of certain chemicals which make a person feel excited and calm at the same time. It may also increase alertness, improve focus, and create a feeling of pleasure. However, this effect only lasts while nicotine stays in the bloodstream. Once the nicotine wears off, the brain is suddenly missing the effect of nicotine, leading to anxiety and poor concentration and tiredness. The body sends strong signals to get more nicotine to fix the imbalance. This is why nicotine becomes highly addictive. At first, smoking may feel enjoyable, but over time, the body starts to depend on nicotine just to feel normal. Moreover, nicotine also increases the heart rate and causes blood vessels to narrow. This increases resistance in the blood flow. As a result, the heart has to pump harder, which leads to high blood pressure. Nicotine also increases the risk of blood clots. If a clot blocks a major blood vessel, it can lead to a heart attack or stroke. Cigarette smoke contains many other harmful substances. Carbon monoxide has no color or smell, but it is extremely toxic. It binds strongly to hemoglobin in red blood cells, which normally carries oxygen. Once carbon monoxide is attached, oxygen cannot bind. This reduces the amount of oxygen delivered to the body. As a result, a person may feel tired and short of breath. When a pregnant woman smokes, the baby inside the womb receives less oxygen. This can slow down the baby's growth and development. Babies born to smokers often have a lower birth mass than babies born to non-smokers. Cigarette smoke contains at least 70 cancer-causing chemicals called carcinogens. They can damage the DNA inside the cells. Some substances, like arsenic and nickel, make it harder for repair of DNA damage. As a result, the risk of developing cancer increases. This raises a common question. If smoking is harmful, why don't smokers quit smoking? Nicotine, the main addictive chemical in cigarettes, is one of the most physically and mentally addictive substances known. Once a person starts using nicotine, it can become extremely hard to stop. Smoking often becomes connected to daily habits or social situations, such as relaxing after work or hanging out with friends. Quit smoking can also lead to withdrawal symptoms like anxiety or depression, because the body is adjusting to life without nicotine. That's why quitting is so difficult. The good news is that quitting is possible, and many tools are now available to help. One helpful method is nicotine replacement therapy. This includes products like nicotine gum, nicotine patches, or vaping with an electronic cigarette. They give a small controlled amount of nicotine to the brain without the dangerous chemicals found in tobacco smoke. Over time, the nicotine dose can be reduced until the body no longer needs it. This is a positive step because quitting smoking allows the body to begin healing, and that leads to better health and a longer life. If this video helped you understand better, make sure to like, subscribe, and hit that bell icon so you never miss a bite-sized science lesson from Edutube. Until next time, keep learning, stay curious, and remember, science is simple.